According to the Washington Post's Fatal Force database, between 2015 and 2020, police have fatally shot more than 1,400 people with mental illnesses in the United States. In the U.S., police shootings resulted in approximately 1,000 fatalities in 2018, and 25% involved persons with mental illnesses. On average, 1 out of 5, or over 25% of fatal police shootings were of mentally ill persons. It's because of a lack of mental health crisis services in the United States that has resulted in law enforcement responding to these calls. In many of these cases, police presence is not even necessary. What individuals need is not to go to jail, but they need to be de-escalated from their crisis and a ride to a mental health facility or possibly the hospital. The Crisis Intervention Team Program is a community-based initiative meant to improve the outcomes when police officers encounter persons in the community with mental, emotional, or developmental challenges. It was developed at the University of Memphis in Tennessee in 1987 after Memphis police fatally shot a man who was threatening people with a knife. The man had a history of mental illness. You will sometimes hear it referred to as the Memphis Model. The Memphis Model is crisis intervention training that requires only 40 hours of training in mental health diagnosis, drug use issues, and de-escalation tactics. The CIT program has been in effect for 2 decades in over 2,700 communities nationwide. After 20 years, large-scale studies now show that there's no consistent reduction in overall arrests or in the risk of death during emergency police interactions, as well as no significant difference between CIT trained officers and untrained officers in terms of mentally ill persons being diverted to psychiatric emergency services. Cahoots was developed by the Whitebird Clinic, a social services center that has operated in Eugene, Oregon since the late 1960s. The Whitebird Clinic was a brainchild of some counterculture activists who saw a hole where a community health center should be. In 1989, after 20 years of earning the community's trust, Cahoots was created. They retrofitted an old van, staffed it with young medics and mental health counselors, and sent them out to respond to the kinds of 911 calls that wouldn't necessarily require police, and in the hands of police, had often turned violent. These calls were crisis intervention, counseling, mediation, calls for information and referrals, transportation to social services, first aid, and some basic level emergency medical care. If not for Cahoots, an officer would have been dispatched to handle these situations. The Cahoots staff consists of medics, either a nurse or an emergency medical technician, and a crisis worker. All staff members are required to have education or previous work experience in crisis counseling, social services, or emergency medicine. Cahoots does not respond to violent situations or life-threatening medical emergencies, and their staff members do not carry guns and they cannot make arrests. The demand for Cahoots services significantly increases annually. It started with just enough funding to staff 40 hours a week, and most recently, Cahoots received an annual budget of $2 million. It now has 3 vans that are staffed 24 hours a day, 7 days a week. It has more than doubled the number of workers, and it has also captured the attention of a country in crisis. In 2020, after the killing of George Floyd by a Minneapolis police officer, Oregon Senator Ron Wyden, backed by Congressman Peter DeFazio, introduced the Cahoots bill to a Senate that was controlled by Republicans. Well, the bill went nowhere. However, a year later, President Joe Biden signed into legislature the American Rescue Plan, which included Section number 9813. Section number 9813 is the state option to provide qualifying community-based mobile crisis intervention services, with increased Medicaid funding for 3 years to states that provide community-based mobile crisis services to individuals experiencing a mental health or substance use disorder. The federal government would pay for 85% of the program through Medicaid. Users of these programs are typically low income, so using Medicaid funding is appropriate, especially since Medicaid is the largest funder of mental health services. After 3 years, it would be expected that states secure total funding to continue the program. This is reasonable considering that Cahoots says the program saves the city of Eugene about $8.5 million in public safety costs every year, plus another $14 million in ambulance trips and ER costs. Diversion programs reduce arrests of people with mental illnesses, while simultaneously increasing the likelihood that individuals will receive mental health services. Mental illness can lead to more encounters with police and the courts. For instance, rates of contact with the criminal justice system among adults with severe symptoms such as psychosis are extremely high. While it's difficult to estimate exactly how much diversion programs can save communities, incarceration is costly compared to community-based treatment. Research shows that an inmate with mental illness in jail costs about $45,000 a year, while community-based mental health treatment costs only about $12,000 a year. And a reduction in expensive inpatient or hospital services results in a significant overall reduction in psychiatric health care costs. It's important to involve the political process. Advocates for change need to work within school systems, community organizations, and government agencies to address stigma and the negative societal attitudes toward the mentally ill. Instead of being value neutral, politicians must begin to speak out for social justice. There exists a belief that only disinterested reformers can create social change. This is because people have an agenda, which often is personal, that gets in the way of their ability to engage in social reform. The mentally ill generally rely on spokespeople to advocate for them. However, in many cases, these spokespeople may not represent the rights of the mentally ill, but their own agenda. The theory of social responsibility explains that every individual has a responsibility to act in a manner that is beneficial to society and not solely to the individual. As teens and young adults, baby boomers promoted racial and gender equality with hope for remaking societal norms. And though they have seen progress in expanding educational, economic, and social opportunities, they have not fully realized the goals of their youth. In part because, like in the 60s and 70s, differing views on politics, religion, war, and social justice divide our nation. 80% of baby boomers are unhappy with the nation's current state. They tend to be cynical and distrust government, and they express a need to focus on individual choices and freedoms. They're currently the most influential economic group and run local, state, and national governments. The baby boomer generation witnessed and participated in some of the greatest social changes in the country's history. During the 1960s and 1970s, with the Civil Rights Movement and the Women's Liberation Movement, they protested the Vietnam War and fueled the free speech movement. Generation Z deals with rising tuition and housing costs, which has delayed much of this group reaching financial independence. However, experts predict Gen Z will surpass the education levels of all previous generations because of its access to abundant resources. This group consists of digital natives, mobile-focused internet masters known for boycotting anything that doesn't align with their values and sharing their opinions globally. They're the first post-9/11 generation. They saw many of their parents suffer through the Great Recession, and now, just as they're entering college and the workforce, they face the pandemic. Members of this generation are realistic, open-minded, and pragmatic. They value uniqueness, and they are highly ethical. Generation Z also value diversity and inclusivity, and they are highly socially conscious and more diverse than any previous generations. Research shows that Gen Z members are unlikely to report their mental health as fair or excellent, which could be why mental health is among the top 7 social issues that command their attention. Gen Z has a big picture mentality. Over half of this group is non-white. Diversity and inclusion are regular. More than previous generations, members of Gen Z express views in favor of interracial marriage and ethnic diversity. However, they are keenly aware of the nation's discriminative nature. One study targeting Gen Z determined that 88% of participants felt Black Americans were treated worse than others. Not surprisingly, 78% used social media to express support of the Black Lives Matter movement. Social judgment theory explains that when there is a match between the message and an existing attitude or behavior, the likelihood of persuasion is high. The Courtesy Call campaign targets baby boomers and college age and older members of Generation Z. Research shows that baby boomers' views on today's social issues are closer to younger generations than older ones. The likelihood is that the campaign message lands in these groups' latitude of acceptance because both groups are social cause-oriented, value health and wellness, individual choices and freedom, and community involvement. Similarly, the elaboration likelihood model describes that in cases of high involvement, when an issue is relevant and potentially impactful, people process messages through the central route. The central processing route is characterized by much cognitive effort to elaborate all aspects of an argument, and strong, thoughtful arguments tend to result in the message successfully persuading, resulting in significant attitude and behavioral change. Social responsibility is not just for businesses. It's for everyone whose actions impact the environment around them. It aims to ensure secure health care for people living in rural areas and to eliminate barriers like distance and financial conditions. One can be socially responsible passively by avoiding engaging in socially harmful acts, or actively by performing activities that advance social goals. Social responsibility must be intergenerational, since the actions of one generation have consequences on those following. It is an ethical framework in which an individual is obligated to work and cooperate with other individuals and organizations for the benefit of the community and the welfare of the society. In the U.S., it has taken society a long time to disregard important values such as social justice, and it's difficult to know where to begin to reestablish these values. Choose action over inaction. What type of involvement on the issues would help us contribute to solving the problem? You can become an advocate for changing the way your community responds to mental health crisis, and encourage a broader horizon for viewing the perspectives of those people suffering mental illness and in crisis. Social awareness is a person's ability to consider the perspectives of other individuals, groups, or communities, and to apply that understanding to interactions with them. From a personal point of view, social awareness is a fundamental part of creating friendships and relationships, helping us to lead happy and fulfilled lives. Social connectedness is often based on friendship. People view others as friends as opposed to viewing themselves as individuals without the need for friends. Friendship teaches us to have regard for the well-being of others, as well as expressing empathy. This idea isn't novel. It's something neighbors have been doing for centuries, and the time is now to take a comprehensive approach to formalizing it to help our most vulnerable communities. To reach baby boomers, we would use print ads in newspapers and select magazines, email marketing, YouTube videos, and television ads. Studies show that print ads display more information and are preferred by baby boomers over other media. Baby boomers like statistics, charts, and graphs, and questions should be answered thoroughly with simple, straightforward facts. Generation Z will be targeted with digital marketing, YouTube short-form video, and billboards and posters on campus. Gen Z wants to collaborate and connect with the world, to cultivate experiences and enhance their personalities. We could leverage the various types of media that surround college students with an omni-channel campaign that boosts repeat impressions, fun stuff like stickers, quizzes, and giveaways. Wall murals, photo booths, branded hashtags, and playful designs prompt them to share their experiences on social media. Courtesy Call will use experts like the National Alliance on Mental Illness and others with lived experience related to mental illness, like personal struggles or who have a close friend or family member who suffers. This gives them authority on the subject. For example, Chris Hubbard, the Cleveland Browns offensive tackle, recently shared how as a child exposed to violent crime, his best friend committing suicide, and the stress related to being a black man in America resulted in him seeking professional help to sort out his emotions. Hubbard encourages athletes to pay attention to their mental health, watch the signs, and express the importance of asking for help. Also, AJ Mendez, a former WWE wrestler who claims her bipolar disorder is a gift. She advocates for awareness by sharing her mental health advice with the Hispanic community. People with lived experiences of mental illness come from various backgrounds and communities and are eager to share their stories and support. Other examples of mental health authority figures include Rosemary Ketchum, the first ever politically elected trans woman in the state of West Virginia, who addresses the need for LGBTQ plus people to advocate social change and a stigma-free world. And Jasmine Pierre, creator of the culturally inspired The Safe Place app, where Black communities can access information and support for their mental illnesses. The Courtesy Call campaign will be measured and evaluated by its impact on emergency room visits, involvement of law enforcement in mental health and substance abuse events, and diversion from jails. As I mentioned, it's difficult to estimate exactly how much diversion programs save communities. However, Perloff uses the psychological approach to campaigns to describe how a message can fail to persuade when it threatens people's values or psychological needs. However, it also explains how campaigns affect behavioral changes in gradual stages and can happen on many levels, for example, private or public. And if this campaign keeps society moving in the right direction, it will have succeeded.